Appreciate you being with us this morning.
Sure. Good to be with you, Scott.
Do you agree wholeheartedly with these new CDC guidelines?
Well, I'm supporting them. The CDC, is walking a tightrope here. They're trying to base these new recommendations on the science. It's clear that you're most infectious just before and just after you develop symptoms. And they're also trying to do it in as simple a way as possible so it's well understood. And of course, there have been folks who say, well, you could have done it this way or that way, distinguishing vaccinated from unvaccinated people or asking for a negative test. But this is an arena where we already know there aren't enough test kits out there. So the CDC is trying to do good and keep it as simple as possible to help us enter 2022 in the most effective way so that our economy, our schools, our universities, our entertainment venues are all functioning as safely as possible.
Understand. Let me ask you about some numbers, if I may. More than 400,000 cases in a single day. The record number of 7-day average cases is now 267,000. I mentioned at the very top of this show, a year ago, had we mentioned those kind of numbers, I can only imagine what would be taking place not only in the stock market, which we cover obviously on a minute-to-minute basis, but in society at large. Did those numbers mean the same today as they did a year ago? How do you think about that when there's more focus, it seems to be, on hospitalizations and deaths, the fact that those are not spiking and that the Omicron variant does not appear to be as severe as was first feared?
You're singing my song. That's exactly what I would say. Let's distinguish cases, particularly among vaccinated people, that are mild, a discomfort for sure, sometimes even putting you in the bed for a day or two, but not requiring hospitalization, from those cases that are severe enough to require you to be admitted to the hospital. Those cases, the hospitalizations, are occurring dominantly still in unvaccinated folks. And that's where our focus is at the moment, to try to reduce those hospitalizations, to get our friends and neighbors who haven't even gotten their first dose vaccinated, get the boosters out to everyone, and to have the parents bring children, now 5 years of age and older, because they're all eligible, in to be vaccinated. So it's very different today than it was 6 months, 8 months ago.
Dr. Schaffner, I think at this point, we all know someone who has caught the virus over the last few weeks, vaccinated or not, boosted or not. And I ask this question on behalf of the C-suite because breakthrough just seems to be par for the course in this variant. Do you think that the C-suite should still be considering vaccine mandates and bringing people back to the office, or should their focus be elsewhere?
Well, I continue to believe, speaking just for myself now, that vaccination is the key, continues to be the key to getting COVID under control, to get through this pandemic phase. Here in Tennessee, we have a substantial proportion of the adult population still unvaccinated. And I've come to believe, rather reluctantly, that we're going to have to oblige people to be vaccinated to engage in certain activities, such as getting on airplanes, going to a museum, going to restaurants, in order to persuade more of them to accept the vaccine. So I know mandates are a bad word, so I talk about requirements and obligations, if that helps any. But I think that's going to be needed to get us, if you will, over the hump. Otherwise, Omicron will just run through, make a lot of those people sick, and will come out at the other end, whether vaccinated or having had infection. I sure would like to prevent many, many hospitalizations that are still in the cards if people don't get the vaccine.
Shepard Smith here. Thanks for watching CNBC on YouTube.